Thank you, Sharon, and thanks to the organizers for giving us the space to present this work. So there are approximately 500 to 600 pregnancies in women living with HIV in England each year, and this is down from a peak of about 1,400 pregnancies seen in 2010. The current rate of vertical HIV transmission in England is less than 0.3% among diagnosed women living with HIV. And we know that early identification of HIV and diagnosis...
Can you just get a little closer to your microphone? Yep.
Is that better?
Yep,
Yeah.
thanks.
And we know that early identification of HIV and diagnosis and initiation on antiretroviral therapy in pregnancy are really key strategies to maintaining these low vertical transmission rates and safeguarding health. So the objective of this analysis was to describe the characteristics and treatment of women diagnosed with HIV during pregnancy in England in the most recent 5-year period, 2018 to 2022. So the Integrated Screening Outcomes Surveillance Service, or ISOS, which is based at the UCL Institute of Child Health in London, conducts active surveillance of HIV in pregnancy in England on behalf of the National Health Service's Infectious Diseases in Pregnancy Screening Program. All pregnancies in women living with HIV, all infants born to women living with HIV, and any children diagnosed with HIV under the age of 16 are reported to ISOS through maternity and pediatric reporting streams. There have been over 25,000 pregnancies in children reported over the last 30 years, and this was previously under the well-known UK and Ireland national study of HIV in pregnancy and childhood. And long-term follow-up of all children and young people living with HIV is carried out through the Children's HIV and AIDS reporting system, also based at the UCL Institute of Child Health. So this diagram just represents the ISOS surveillance process with, on the bottom, the gestational weeks of a pregnancy and then the infant's life in months. So like I said, ISOS is an active surveillance system with national coverage for all of the screened for infections in pregnancy, which HIV, hepatitis B, and syphilis in England. So just to walk you through for HIV, each quarter, the first step is that all maternity units in England complete a green card reporting the number of pregnancies in women living with HIV that they've seen in the previous quarter. This is then followed by a pregnancy notification form, which is completed for all pregnancies reported after the initial antenatal care appointment or later in pregnancy if diagnosis is later. This is followed by a pregnancy outcome form, which is issued to the clinical respondent at the time of the estimated date of delivery. And pediatric follow-up is undertaken for all infants born to women living with HIV through pediatricians who also report independently to ISOS, and pregnancy and pediatric reports are linked. And children are followed up to about 2 years of age until infection status is confirmed. So in this analysis, we included all pregnancies in women living with diagnosed HIV-1 reported to ISOS with a booking for antenatal care between the 1st of April 2018 and the 31st of March 2023, and reported to ISOS by the 30th of June of last year. One pregnancy was excluded for missing timing of diagnosis. And we assessed trends using logistic regression and Cusick's nonparametric test for trend. And we present data by the screening program fiscal year, which runs from the 1st of April to the 31st of March, and this will be called the screening year. And we define delivery viral load as the latest HIV RNA measurement in pregnancy, dated up to a maximum of 30 days before or 7 days after delivery. So there were 3,106 pregnancies reported over this period, with a decline in the annual number of pregnancies seen over time. Diagnosis occurred during pregnancy in 342 of these pregnancies, or 11% overall. And over time, we saw a slight increase over time in the proportion of pregnancies with diagnosis during pregnancy, increasing from 10% in 2018 to 13.5% in 2022-2023 screening year. In terms of absolute numbers of pregnancies, Looking at both pregnancies with pre-pregnancy diagnosis and pregnancies with diagnosis during pregnancy, we saw declines between 2018 and 2020. And for pregnancies with pre-pregnancy diagnosis, this downward trend sort of continued, although it begins to plateau. Instead, for diagnoses during pregnancy, we did see an uptick in the number of women diagnosed during pregnancy between 2020 and 2022, following these earlier declines. Of women diagnosed during pregnancy, of the 342 women, median age was 31 years. The vast majority, 84%, were born outside the UK, with 60% born in Africa. Hepatitis B and syphilis co-infection was present in 2% and 3% of women, respectively, with syphilis being more prevalent among women diagnosed during pregnancy than among women diagnosed before pregnancy. Mode of HIV acquisition was reported to be sexual contact for the vast majority, and nearly 3/4 were reported by maternity units outside of London. We saw some shifts over time in the geographic distribution of diagnoses during pregnancy, with the Northeast and Yorkshire accounting for an increasing proportion of women diagnosed during pregnancy, and the Northwest accounting for a decreasing share. In terms of absolute numbers, for most regions outside of London, regions saw up to a maximum of about 15 pregnancies annually with a pregnancy diagnosis, with many regions seeing much lower than this. In terms of region of origin of women diagnosed with HIV during pregnancy, we saw women born in Africa accounting for an increasing proportion of diagnoses during pregnancy over this time period, and women born in Europe outside the UK accounting for a decreasing proportion. Looking a bit more closely at these two groups, we saw a decline in the Europe group in terms of numbers of women, numbers of diagnoses, particularly among women born in Eastern Europe. And we saw in the Africa-born group an increase in the number of women diagnoses in women born in Western Africa. Of those born outside the UK and for whom we had information on the timing of arrival in the country, 50% arrived a year or more before conception, 31% arrived in the year before conception, and 18% arrived during pregnancy. And looking at the world region of origin by timing of arrival for women who were born outside the UK, we can see that among those recently arrived, so arriving in the year before pregnancy or during pregnancy, there was an increasing number of pregnancies in women recently arrived from Africa being diagnosed in pregnancy. And the most common countries of origin for those women born in Africa, these were Nigeria, Ghana, Zambia, Zimbabwe, and Sierra Leone. Median gestational age at diagnosis was 12 completed weeks. The vast majority, 91%, were diagnosed through antenatal screening. The median first CD4 count in pregnancy was 356, so about half had his first CD4 count of less than 350, and 19% had his first CD4 count of less than 200. 305 out of the 342 women had a pregnancy resulting in live birth, with the remainder having pregnancies resulting in miscarriage or termination or having an unknown outcome, although 12 out of the 13 of those with an unknown outcome had left the country during pregnancy. Of those pregnancies resulting in a live birth, all women received at least some antenatal ART. Gestational age at ART start was a median 16 weeks, and the time from diagnosis to ART was approximately 3 calendar weeks, with these being consistent over time. 29 women were diagnosed in the third trimester, accounting for about 20% of new diagnoses. although 28 out of these 29 actually had their diagnosis in the third trimester as well. In terms of viral suppression by delivery, delivery viral load was less than 50 copies per mil in 89% of those diagnosed during pregnancy and having a live birth. And this compares to about 94% among those diagnosed before pregnancy. 28 women were diagnosed in the third trimester, and we saw an increase over time in the proportion of diagnoses during pregnancy occurring in the third trimester. 20 out of the 28 women diagnosed in the third trimester arrived in England from overseas during pregnancy or in the year before pregnancy, and 24 out of 28 first presented for care in the third trimester. And of note, more women diagnosed in the third trimester had a delivery viral load of 50 copies or more over time, 1 in 4 in 2018 and versus 4 in 7 in 2022. So in conclusion, we saw a slight increase in the proportion of pregnancies with HIV diagnosis during pregnancy, which is likely driven by several factors, including an increasing number of women recently arrived in England from countries with higher HIV burden. And there have been some evident shifts in the underlying characteristics of women diagnosed during pregnancy, largely reflecting UK migration patterns. Syphilis co-infection among women diagnosed with HIV during pregnancy at 3% is notable and warrants further investigation, although there was no trend increasing trend seen in this. HIV diagnosis late in pregnancy and at late clinical stages persist in some cases, but in many cases this is related to migration during pregnancy and or late presentation for care. Overall, very reassuringly, there is prompt diagnosis and initiation on ART for those who are diagnosed with HIV during pregnancy in England, and ongoing surveillance is really important to support the delivery of clinical services. So thank you to all those whose data were used in this work, the ISOS respondents and the ISOS team. If you have any questions, I have my email address there and the link to the ISOS website if you're interested. And just to flag, the ISOS 2023 HIV annual report is available on gov.uk, and the 2024 report is due to be released this spring. So thanks again.